On Legally Blonde and Blind, I spend quite a bit of time talking about what it's like to be a blind student in Washington, D.C. However, that does not cover the vast majority of experiences within the blind community, which is why I am very excited to have on a special guest, Sean Curry, Assistant Director of Programs at Prevention of Blindness Society, to talk more about vision loss and the importance of preventative care. Tune in to learn more about how income, transportation, and other social determinants of health influence access to vision care in the United States, and what we can do about it. Welcome back to another episode of Legally Blonde and Blind. I am so excited to have on another guest, Sean Curry. Sean, take a minute to introduce yourself and then talk a little bit about why you're here today and what you do for prevention of blindness.
All right. Thank you, Marissa, and thank you everyone for listening in today. My name is Sean Curry. I am the Associate Director of Programs at the Prevention of Blindness Society of Metropolitan, Washington. We are a vision and eye health nonprofit located in the DC metro area, serving DC proper, suburban Maryland, and Northern Virginia. And we've been in existence since 1936. We're dedicated to the improvement and preservation of sight and quality of life. And we do that through services, education, and championing healthy vision and innovation to everyone in our area.
Could you sum up exactly what POB does in the DC metro area? Like, what are some of the services you provide?
Yeah, so every year we serve around 10,000 community members. We do this through a suite of we call them sight saving programs. And these include the entire range of ages as well as the entire range of vision levels. So we have a children's vision screening program where we go into primarily preschools and elementary schools, but we also go to secondary schools as well to provide vision screenings. If a child fails a vision screening, we then refer them out to a doctor and follow up with them to ensure that they were able to get to an eye doctor that they needed to see. In addition, we have a children's mobile clinic. So we do the screening, but then we also have an eye doctor on hand to perform the exam on the same day and also prescribe them 2 pairs of eyeglasses for free if they need them. In the adult world, we do have an eyeglasses clinic for those who are either underinsured or uninsured. So folks who maybe need a pair of eyeglasses, but for one reason or another, their insurance doesn't cover it, or they're just not insured, we can provide them with prescription eyewear at a much reduced cost than what would be typically out of pocket for them. We also then have an adult glaucoma screening program and visual acuity screening program, very similar to the children's program, except we go to health fairs and places of work, government buildings, so on and so forth, to provide these glaucoma screenings and follow up with them to make sure that they get their eyes checked out if they need to. And then finally is our low vision programs. And these include a resource and support group network, a low vision learning center and resource center, and then low vision rehabilitation. We work with a practice that has doctors on hand who specialize in low vision rehabilitation.
That's great. There's so many services that your organization provides, ranging from more of the preventative care to some of those rehabilitative services. I think you guys really cover the whole vision loss playing field. It's interesting because when I was younger, I used to wear glasses. I don't anymore, but it actually was not covered by my insurance because it wasn't quote unquote medically necessary for me to have them. So I was very privileged to be in the position where my family could afford the rather expensive prescription because I have such low vision.
Absolutely, yeah. It's always interesting to see what insurance companies deem medically necessary.
Now, to get started, why is preventative care so important for eye health?
Yeah, that's a really great question. And, preventative care in eye health is very important. There's been multiple studies that look at, and I'm going to focus first on looking at it at an individual level. There's been multiple studies that have shown the cost of vision loss per person goes up very quickly as we get to more progressive vision loss. So, if you're able to catch a lot of these eye diseases early on, Primarily the aging eye conditions such as, macular degeneration, glaucoma, diabetic eye disease, and cataracts. If you catch them early and get treatment early on, it can oftentimes prevent unnecessary vision loss from happening. So you may eventually go blind, but if you don't go blind until you're 130 years old, chances are you may not make it that long. So you may never go blind in your lifetime. Um, in addition, even with the more genetic related diseases that affect children and young adults, such as RP and Stargardt's and that kind of thing, um, preventative care, getting your regular eye checkups and taking care of that is still really important to try to slow the vision loss from happening, or at least extend the number of years you have with good enough eyesight to where you can learn about all of the resources, services, and technologies that are out there so that you are better prepared whenever things do end up getting progressively worse. So there's a huge cost to losing your eyesight. And again, especially with the aging eye conditions. In addition to the cost of it, just the other thing too is just life quality and having your vision for as long as possible is so important. A lot of folks that start losing their sight, we see a lot of we do work a lot with older aging adults who are losing their sight. The more vision that they have, or the longer that they have enough vision to learn about all the resources and services and technologies, life quality seems to be better whenever we work with them and provide them what they need to be able to do that and to age in place helpfully, as
Yes,
well as
100%.
maintain their independence.
No, I agree. I think it's really interesting thinking about the degenerative eye conditions because it really does. You don't just have to think about how am I going to function with the vision I have now, but you almost have to prepare for the future when you could lose more of your vision or even go completely blind. A lot of training centers actually will have you do everything completely blindfolded just so you get a sense of what it's going to be like in the future. But it's even harder if you're older and you don't have the like time or like capacity to adjust to it as well as you could if you were younger, or if you don't have access to a training center to begin with. How often should people receive eye exams, and should the frequency increase as you get older?
Yeah, so the general rule that you see from organizations such as the American Academy of Ophthalmology is that you should get a comprehensive dilated eye exam every 5 to 10 years until you hit the age of 40. And then from 40 to 60 or 64, it should be every 1 to 2 years. And once you get to the age of 65, you should be getting one every single year. This has a little caveat, though, a little asterisk, that if you have an eye condition already, you should definitely go as often as the doctor recommends. So I've seen younger adults getting eye exams every year, even less so, even more frequently, depending on the eye condition that they have. And then older adults, if you have age-related macular degeneration, the leading cause of vision loss among older adults, you may have to go every 6 to 12 weeks to get an eye shot in if you have wet AMD, or for regular checkups every 3 to 6 months as well. So it does depend on what you have, but if you don't have any problems now, the general rule of thumb that I said earlier is the best way to go about it. I try to get an annual checkup every year anyway. I don't really have any vision problems personally, except wearing eyeglasses, having prescription eyeglasses. But really, getting that annual eye exam is beneficial for us. And especially if your insurance covers it, there's no reason not to go get one.
No, I agree. So, what is the current state of vision care access in the United States, especially in the DMV area in which POB serves?
Yeah, so I have most of my knowledge is in the DMV area. I will say, there seems to be a lot of repetitive patterns from research that I've read on, as well as from what I've heard from others throughout the rest of the country. But care access, it's getting better year to year. Um, the major, and there's not really a shortage of eye doctors per se. The major barrier seems to be insurances, and a lot of, because vision care doesn't most vision care does not get covered under your medical insurance. You normally have to get vision care insurance as well, which can add up, and it's something that people don't think about until they need to go get their eyes checked. So it really comes down to that. Um, Public insurances such as Medicaid and Medicare. Medicaid is the insurance that covers those of us who are lower income primarily, and it does a decent job in our three states that we're in now: Maryland, DC, and Virginia. After Medicaid expansion occurred, most recently in Virginia, I believe in 2019 or 2020, it does cover a larger percentage of people that really could benefit from it. And you typically get an eye exam covered every 1 to 2 years, and a pair of eyeglasses every 1 to 2 years as well. So that's a good thing to see. Those of us on Medicaid, you often have other social determinants of health out there, or other problems that you have to overcome, such as transportation or getting off of work, which can be very difficult as well, to be able to get to the eye doctor. In the world of Medicare, Medicare doesn't cover traditional Medicare, I'll say that, doesn't cover eye exams except for a couple qualifying things, such as if you're a high risk glaucoma person, you're diabetic, and some other option items as well, like post cataract surgery and all of that. So you oftentimes have to buy an extra plan via Medicare Advantage or Medigap to be able to get the vision care coverage that you need.
So what do the options look like for people who are on Medicaid for eye care?
Yes, so we actually, over the COVID-19 pandemic, we completed a project identifying the eye care practices, both optometry and ophthalmology, in the DC metro area, the area we serve. And we identified, ones that accept Medicaid as well as Medicare, and if they're accepting new patients and so on and so forth. One of the things that we found, though, first is that most every practice will accept Medicare, so that's good. That's a good sign. However, when it comes to Medicaid, it seems that it changes frequently whether or not a practice accepts Medicaid. Unfortunately, Medicaid is not a profitable um, insurance provider for a lot of practices, so they need, they got to be able to keep their doors open as well. And Medicaid doesn't reimburse as well as a lot of private insurances, but there's still a lot of practices that accept Medicaid in the region.
So, are there certain communities that are disproportionately impacted by blindness and vision loss? I know you talked a little bit about social determinants of health beforehand, but I think it'd be great for my listeners if you could explain what that is and how that relates to vision loss.
Sure. So the social determinants of health are the other factors that impact whether or not we get health. We maintain healthy, healthy mind, healthy bodies, and a lot of it has to do with factors that are related to income, housing, transportation, food security, your lived environment, so on and so forth. And, you know, with social determinants of health, you tend to see that those of a lot of people who live in more rural areas, as well as those who are in more lower income areas as well, tend to have more of these social determinants that impact their abilities to get to an eye doctor, as well as just general health care as well. A big one in the DC metro area, well, there's two big ones there, is that one is transportation. If you ever lived in the DC metro area, you know that transportation can be difficult. The good news is that the metro system in DC is actually a pretty good one on the east compared to the other East Coast ones. And there is a disability service, Metro Access, out there that covers that as well. So it is a decent one. The problem is that when we get out to areas such as the big one for me that I've noticed is Prince George's County, there's not a whole lot of metro stretch out that way, and there's not as much built up over there. So that can create a barrier if we don't have a car to drive to and from places. The other thing is cost. Cost of living in DC Metro is pretty high, and so a lot of people who maybe live at only even 300% or even at 300% of the federal poverty level, that is still just barely at what's called a living income or a living wage. So it's expensive to live here. So people then will move farther outside, or they'll be stuck in areas that are not great areas to live in. So it can make getting your eyes checked out even more difficult as well.
And it's probably even harder if you're working a job with longer or off hours and you can't make it to an eye clinic when they're open.
Absolutely, yeah. And I like to give the example. We had a mother come with her child because we had a mobile clinic, and the mother's she was a single mom who had two kids, both elementary school age. She's working two jobs, trying to pay, being able to keep food on the kids' table and keeping a roof over their head. And they, one of the jobs is a night shift. The other job is a swinging schedule that she doesn't know the schedule until 2 weeks before. So it's very difficult to schedule eye care exams, let alone child visits and all those other things that you have to do for a child, if you don't know what your schedule is until 2 weeks out. And you can always ask off and take the time off, but then you're not going to get paid for that time period, which can be a problem. And also, some employers may not appreciate you taking time off with only a 2 week notice, or asking for extended time off for things such as this. You had asked about whether there was certain populations that are affected by by blindness and vision loss. There's a couple aging eye conditions that are that seem to follow some genetic factors. So things such as glaucoma impacts African Americans more. I believe the most recent state study was 3 to 4 times as likely if you're African American. And then cataracts, with cataracts, most people are going to get cataracts in their lifetime if they live long enough. Diabetic eye disease. If you're diabetic, you are at high risk of getting diabetic retinopathy. So, look at the studies that show increased risk of diabetes among different populations, and it seems to impact those of Hispanic ethnicity as well as African Americans a little bit more than Caucasian. But again, a lot of this has to do with genetics as well. Example with glaucoma is that if you have a brother or sister that has glaucoma, you're 6 to 8 times as likely to get it. So there's definitely a genetic component there.
Yes. It's interesting too because I did an episode a few months ago about gender and blindness. And there's even studies indicating that women are more likely to experience vision loss from conditions that are preventable because of lack of access.
So it makes sense because on average, two women live longer. So the longer you live, the more risk you have of having an AGI condition. But there also is the idea that women are providing for their family, especially in some of these other communities around the world. So they don't really put their own health at a priority until things are too late.
So my next question for you is, how has the COVID-19 pandemic impacted access to care and POB's initiatives?
Yeah, that's a really great question. COVID has had such an impact on healthcare in general. And in the world of vision care, I think it has impacted. For at least in the first 3 months of COVID, a lot of eye care practices weren't open except for absolute emergencies, such as those who have wet AMD or diabetic eye disease that need their eye shots, or those who have glaucoma to get their eye drops. But a lot of folks didn't go see their eye care provider for an extended period of time. And another thing that we're seeing now is a lot of children are becoming increasingly myopic or getting myopia from the extended screen times now. They went from being in person in the classroom to virtually all hours of the day, and they've seen a correlation of an increased number of children who are short-sighted and need eyeglasses. So there's definitely something going on with that. I don't know a whole lot about COVID causing any sort of eye conditions or increasing chances of that. I don't believe that there's been enough information at this point about that.
It's
Um,
just more of like a
yeah,
lack of access to care at this point.
it is. Yeah, it's primarily lack of access, or maybe not lack of access, but fear of going to the eye doctor or going into the doctors because of COVID. I believe that's gone down increasingly over the past year or so with people getting vaccinated and more care being opened up and all of that sort of thing. And us kind of like getting back to, the new normal, as a lot of places are calling it.
And how has this impacted what POB does for the community?
Yeah, so POB, we had to move everything virtually. And one of the first things we did whenever we had to move virtually was we recognized that those who are vision impaired or who are legally blind, isolation is already a high risk for a lot of people with these conditions. And with COVID happening, it's just going to get even worse. So we realized, all right, we need to pivot quickly here and get connected with our clients. So what we did was we created a town hall where one of our myself and one of our low vision doctors, Dr. Alibi, we led and facilitated this town hall to keep folks connected with the latest. Initially, it was all the latest information and resources for COVID, as well as everyday living things such as how do I get my groceries now that I can't go to the store. But then it's now transitioned to focusing more on topics that are interesting for this community, such as resources and services and newest technologies and the latest research and that kind of stuff. So we really pivoted hard there. And these town halls are still going on now. Our resource and support groups had to move to virtual. A couple of them decided to take a hiatus for a year. Now a lot of them are back up and running, thankfully, and we haven't really had a huge drop off. I attribute a lot of that to our newsletter that still went out, as well as the town hall, keeping people connected with what we're doing and keeping them connected with others experiencing vision loss, because that's so important.
Oh, yes, it is great to have that community, even in a virtual environment, keeping those people connected. And is it possible to do telehealth eye exams or consultations? Are you guys exploring that at all?
Yeah, so our low vision specialists, they did a little bit of telemedicine for a while, but as soon as they could get back to meeting in person, they did transition more to that. I believe they still do a little bit of telehealth, but most folks are now electing, because you really get most of your benefits to in person when it comes to low vision rehabilitation. They're electing to come in person now, so that's what we're doing for the most part.
Yeah, my state's commission for the blind, they had virtual services for over a year. So it was pretty challenging because I was learning how to use a white cane and I only did it online.
Yeah, and the other thing to keep in mind is a lot of our population are older adults who maybe are not the most technically sound. So now we're asking those who are not technically sound, who are losing their sight, to figure out how to get on a Zoom call.
Yeah.
So most of them have figured it out by now, and for over a year now. But that first 3 months, it was very difficult. I mean, it was difficult for the average Joe, let alone someone losing their eyesight who can't see the buttons to click on the internet.
Yes. So pivoting on to like what people can do for prevention of blindness, how can people really support this mission and contribute to your cause?
Yeah, so first, you can always visit our website, youreyes.org, to see more information. And there's a donate button in the top right for all that kind of thing. But if they want to share information, volunteer, or join a group, you can. I mean, I would recommend just giving us a call or shooting me an email, and I'd be more than happy to connect you to what you need to be connected with. So I can give that information now if that's.
Yeah, that would be
Yeah.
great.
Okay, so my email is scurry, Curry, at youreyes.org. Our website is youreyes.org. And you can give our resource hotline, our low vision resource hotline, a call, which is located at our Low Vision Learning Center, which I don't even think I've talked about quite yet, but it's a really great service to the community. The hotline number is 301-951-4444.
That's great. Thank you for sharing. And how can people spread awareness about the importance of getting eye exams? The holidays are coming up for a lot of people. So how do you recommend talking about this with family members, spreading the word?
Yeah, so I'll start with, if you have an eye condition and it has a genetic factor to it, such as glaucoma, or RP or Stargardt's, any of those, let your close family members know about it and tell them, you should really just consider getting an eye exam. It's affected me, and there is a genetic component to it, so you have a higher risk of getting it. And if there might be pushback, but just kindly say, really recommend, I want to have your best health in mind, and I'm only saying this and recommending this because I care about you. So really just that sort of way. And if they want to learn more, don't be afraid to share a little information you may know. There's a lot of information about these eye conditions and diseases on our website that you can share, as well as links to these conditions as well. Also on our website is a resource guidebook that we have for the DC metro area, with all the resources, services, and technologies available to those of us with low vision or legal blindness. So that is available for if they have any questions about finding different resources and services, or also finding more information about their aging eye condition. There's links to those resources as well.
I think there can be a lot of fear and pushback about getting these eye exams for family members of somebody with like a genetic eye condition, because I think there's so much fear surrounding blindness, but it doesn't have to be a tragedy. Sight doesn't have to equal quality of life. There's so many resources and technologies out there, and I think making people more aware of them can help relieve some of that stigma surrounding vision loss.
Absolutely. And the other thing too is, a lot of these eye conditions may not have early symptoms, or you may not even realize that you're losing your sight because it's progressing very slowly. So, a lot of the times you always hear that term, ignorance is bliss, but when it comes to your eye health, that is not the case. Get it checked, get yourself caught. If you have something, it's better to catch it early and get treatment early on, and also to learn about these resources and services and technologies early. It's a lot easier to learn how to use this kind of stuff and do your own research when you have more vision, than it is with all of a sudden everything, you can't read anything, and then you're trying to learn and research without being able to see, and you don't know how to do that yet.
And finally, my last question for you is, how does POB ensure that blind people or people losing vision are involved in your organization's efforts and are really playing an active role in this kind of activism?
Absolutely. So what we actually employ, let's see, one, two, three. We have 4 employees now that are blind or vision impaired. So we really like to engage those, especially with our low vision programs. In addition, it's always great to, don't be afraid to be an advocate. Join one of our resource and support groups, because that's a great way to get connected with others experiencing vision loss. It's a way to be a self-advocate, or to advocate with others, to show them or teach them or explain to them all these resources and services. Folks are always trying to learn, and if you have information to share, that's a great place to share. It's a great place to also meet others experiencing vision loss, and make form long-lasting connections and relationships there.
There
So
really is
yeah.
nothing that compares to learning from other blind people, and that's something I've especially realized after starting this podcast. Is there's so much you can gather from the experiences of older blind folks, because I think even like sighted mobility instructors, for example, they don't have the lived experience of being blind 24/7. They may have to be in a blindfold for an hour for training, but they don't really get that experience 24/7. So it's really valuable to be a part of these groups, and to have an organization that facilitates these connections is really special.
Absolutely. And one thing I've also, and this is might be helpful for those of you who are trying to connect or share with others who are just lost their sight, is that being patient is the most important thing with a lot of this, because there's not just the act of having to learn about these resources and technologies and whatnot, but there's also the emotional component of losing your sight, especially those who have had sight their whole life and then all of a sudden they can't see. There's a major emotional component to it. And just you have to realize and recognize that it's not just learning about what's available, but it's also accepting, like you said earlier, that this vision loss has happened. Okay, we got to move on, and still, because we still want to be able to enjoy our life. And there's a whole aspect there that has to be addressed as well. So just being patient and supportive is so important to getting high quality outcomes out of folks, which is what you want at the end of the day.
Well, thank you so much, Sean, for joining us today. Is there anything else you'd like to add before you go?
I don't think so, Marissa. I really appreciate you taking the time. And for those of you who don't know, Marissa's done a really great job with her work at her university and has been a contributor to a really great service that they provided to us recently with a marketing campaign. So thank you, Marissa. You do a really great job, and that group did a great job. And I appreciate all of that. And I appreciate that you have this podcast as well for the advocacy and to connect others.
Thank you all for listening. I hope you enjoyed today's episode. I found talking with Sean really insightful, and it helped me gain a better understanding of the challenges associated with vision loss. There are so many ways to live and enjoy your life that aren't reliant upon sight. But if that's what you've been used to for the past 40, 50, 60 years, adjusting to that vision loss is going to be a huge adjustment, and you're probably going to mourn the loss of that sense. I was thinking about it this way. I absolutely love to get outside and walk. It's my favorite way to exercise and de-stress. So if I were suddenly in the position where I was paralyzed and couldn't walk, I would initially be devastated that I could no longer partake in this hobby. Does that mean I would be miserable for the rest of my life? No, but it would be a huge adjustment for me. Overall, I hope you learned more about vision care in today's episode and how you can help prevention of blindness. If you like today's episode, make sure to subscribe to Legally Blonde and Blind on Spotify, Apple Podcasts, or anywhere else you get your shows. You can also stay up to date by following my social media pages on Facebook and on Instagram at legallybb_. Thank you for listening, and I hope to see you soon.